with the some of the audio thing. I enjoy a capacity to project, and I'd be glad to speak up a bit. It's just I have to shepherd my voice through the day, or else I lose it by the end of the day. So I'll try to. If people in the back, let me know if you cannot hear me. Okay, but we'll see if we can get the microphone back working. Okay, so we're going to be in a transition here to some conceptual material on motivations for system science and agent-based modeling. This is going to take us away from the keyboard, but because of some questions I got, I did want to draw your attention to something on the Dropbox. Specifically, on the Dropbox, you'll find an area called example models, and there's one folder here called example live lecture exercise models. These are models we're going to be building predominantly this afternoon together, and these provide sort of the complete versions of those, so that if you miss it, or if you're not able to keep up, you can always load one in. But the other thing I want to draw your attention to that I mentioned earlier is this generic example models. And one of the reasons I wanted to draw your attention to this is because what I was just showing you in our first session there was a toy model. It was a model that was deliberately chosen to be as stylized as possible, to boil it down to the simplest thing, to avoid throwing students off, getting them overwhelmed by the details in the model. However, I recognize that a great many of you have really strong interests in empirically grounded modeling. And if you're going to apply this sort of agent-based modeling, you want to do so in models that are rich, tied to empirical understanding of textured health issues, and that are grounded by a lot of empirical data. This is the space I work in. This is, if you go look at my publications, that's where I do most of my work. And it's actually fairly rare that I work with models as stylized as what we've seen. Those are for didactic purposes. And in this folder, you will find a variety of models that are span the gamut from chronic disease, infectious disease, zoonotic, maybe a bit of environmental epi, that and some of those, a number of them are highly data-driven and data-grounded. And I would suggest that you might want to look through some. And for those who are interested, I could refer you to particular models. But there are some in there that years of work have gone into sort of tying them to a very detailed depiction of the health challenges. This, for example, with stages of HPV infection and immunity and development of cancer. In another case, very articulated depiction, for example, of kidney function and transplant processes, dialysis modalities, etc., in ways that are really tied in with extensive data sources. So if you folks have an interest in this, I could give you a list of models which are more data-driven. But I didn't want to make your first encounter with AnyLogic be a model like that, because I thought it could just be, like, what the hell? We'd have to have Kurt stand by the door and lock it or something. And he might defenestrate me through that window. So these things are there. They're available for you, and I have other models of that sort which I haven't put on the drive, but I could give you privately because they're involved collaborators that I can't circulate them publicly, but I could circulate them privately. But just be aware that there's two very pronounced traditions within agent-based modeling. One which used to extremely simple models, stylized models that are aimed at insight, that are aimed at helping think through in a systematic way certain basic understanding of processes. And I'll mention a few examples that you'll find in the literature. Sugarscape would be an example one. Schelling segregation model is perhaps one of the most classic of these. And these models are aimed not at depicting a particular empirical context, a particular situation. Schelling segregation model doesn't depict Detroit and segregation in that city. It doesn't depict Watts here in Los Angeles. Instead, it's a depiction of sort of basic processes that give aha moments that explain how possible patterns we see in the real world at a high level, at a phenomenological level, at a level of qualitative patterns, how they can be explained through certain very simple processes. Might be plausibly explained. On the other hand, there's a very rich tradition exemplified in other projects, and I note Ross Hammond's work in obesity, I note and other work in the Envision and ComNet projects, of which I had some part early on, but also work in the area of infectious disease transmission with the MIDAS project here in the States, Model of Infectious Disease Agent Study. These are highly empirically grounded, tied in with the latest research evidence, etc., and this is a kind of has a very different feel to the modeling. The models are often much bigger, much more articulated, and you're not seeking just high-level insights. You're instead going for quantitative trade-off between intervention options, for example, or you're trying to explain at a very quantitative level what would be expected under certain assumptions about the regulatory environment or what have you. So these are different traditions within agent-based modeling, and what I showed you was most emphatically a toy model. But that's not to suggest that we're limited to toy models. Far from it. It's just that's the most easiest thing for students to encounter without ceasing up. Okay. Okay. So those were some comments on the diversity